I've pretty much been heavy set my whole life. I would feel very depressed. You don't like the way things fit, you don't like the way you look. So you try to compensate, with either being the funny girl, or, you think your personality changes.
34-year-old legal assistant Leslie Lydon has always struggled with her weight. She's tried everything from protein diets to weight loss pills. Nothing ever kept the pounds off.
Your food is your friend. You're happy, you eat. You're sad, you eat. You're disappointed, you eat. It's like, oh, that piece of cake's going to make me happy, or yeah, that extra piece of steak, they'll help with the depression.
But today, Leslie, a mother of 2, is taking a step toward a healthier lifestyle.
Ready, Freddie?
We're ready.
Come on down.
She's having the same weight loss surgery her mother, father, and sister have all had, a lap band procedure at Beth Israel Deaconess Medical Center.
The lap band is a device, and what it does is it puts a belt around the top of the stomach, and it's secured, and it just locks down. And what that does is it puts some restriction around the top of the stomach, right below the esophagus. So when you tighten it by putting fluid in through the port, the balloon on the inside gets tighter and puts a little hold on the top of the stomach. It makes for a very small stomach, and that restriction makes it so you're just not hungry.
Dr. Dan Jones has performed hundreds of lap band procedures. The procedure involves 4 to 5 small incisions and typically takes about an hour. Unlike more major gastric bypass surgery, patients usually go home the next day. As with any operation, there are risks, including infection. Dr. Jones says for most, the benefits by far outweigh those risks.
Typical patient's probably about 100 pounds overweight. Might have type 2 diabetes and back pain, reflux disease, a sleep apnea machine, might have infertility, and we even know the risks of obesity are associated now with cancer. If we get the weight off, most, if not all, these problems go away. It's probably one of the things we do in surgery that can probably have the biggest improvement in quality of life.
Dr. Jones says most patients will lose about 50% of their excess weight with the help of the program's nutritionists, exercise physiologists, and support groups. Some will drop up to 70% of their excess weight.
It's gradual, which I like about it. It's just, I think the slower you lose it, the longer it stays off.
Leslie's mom, Denise, was so heavy she could barely walk from the couch to the kitchen. She has lost 94 pounds since having the lap band procedure 2 years ago.
Good job.
The weight loss has meant Denise now needs fewer diabetes and blood pressure medications. Her cholesterol has gone from out of control to perfect.
I'm still overweight, but I just feel like a wonderful new person. Like I actually can say I like myself.
Leslie's sister and dad also had successful lap band procedures, each dropping more than 100 pounds.
Watching how they've dropped the weight, not even necessarily the weight, their attitude towards life now, they have a whole new lease on life. I mean, they look wonderful, don't get me wrong, but the 3 of them are just much happier.
And Leslie wants to be healthier so she can enjoy a long life with her family.
To be able to chase after my kids, not to be tired at 8 o'clock at night, because I'm sure a lot of it has to do with the weight. I have back problems. You're not telling me the weight isn't affecting that. I'm sure it is. And within the next year or 2, just to be more healthy, more presentable, and obviously much more happier.